there's an inverse relationship between quality of lecture and the presentation and the introduction. If your expectations go so high, it's hard to meet it. Can you all hear me? Because I was told that the microphone is not working. Can you all hear me? If not, kindly come forward, because I have a little bit of tender throat and I don't want to tax it too much before I finish my lecture presentation. Okay.
Don't be shy about coming forward.
That's why I meant to come forward, that way I don't have to shout, okay? And normally when I give a talk like this, I'm getting tired to listening to myself. I've been teaching for 44 years now. So I like to engage the class as we go along. But given the topic today and time, that may not be very, we may not have enough time. But I would like to, for sure, save some time at the end of the presentation for questions and discussions. But you can hear my accent is not exactly American accent. So if you don't understand what I'm saying, something is not clear, raise your hand, stop me, I'll clarify, but don't ask long questions in the, okay? All right. So topic is human rights and global health, right? I don't think I have to convince this group that human right is a very important factor in the health and quality of life of people, right? We don't have to argue about that point. Usually you have to say why we talk about human rights in health. If you don't want to, if you want a specific example, just look at the newspaper of yesterday. The United Nations Commission found that Assad really did use sarin gas, right? When the government uses gas against its own people, they are directly violating the citizens' right, right? And health consequences are very clear. I don't have to lecture about it. But the main question then becomes the world, especially in global health. We're dealing with many different countries, different religion, different cultures, different histories. So the first question is, can we agree what are the rights which are basic to all people? And if we can agree upon it, how do we define it? And that is a very difficult task. So what I would like to do is the first part of my presentation today, I'll talk about the human rights and the changes that has happened in healthcare and health research in the world and in this country, and what does it mean for human rights in that context. Would someone time me, because I have 40 minutes, someone time me about exactly at 20 minutes so I can switch gear and go to the next topic. And also 5 minutes before the 40 minutes is over, give me a signal so I can wind up, because the topic is very emotional to me. And when I get involved with that, I lose track of time. Okay. All right. Now I use this, right? Oh, what happened? Okay. One of the ways to define what is human right is what we call the values that we have. Okay. And philosophers use the word deontological, means moral, what is right to do. And one of the ways to define human rights for health is what is morally correct. Okay, that's one way of defining it. But what is morally correct is very different in different places, different times. So that makes it very difficult to have a consensus, and we'll come to that point a little bit later. The second way to do that would be called utilitarian. We do those things that in the long run help us. For example, in the field of women's health, there's a big debate going on. Actually, it started initially. Women need special attention because I'm not talking about 50s and 60s, that women are weaker and they need more help and they need more protection, therefore we have to pay more attention to them. In other words, argument was made that serve the women better for their own right and health. But today the discussion has changed quite a bit. Today's discussion, if you look at the economics and sociology and philosophy, the argument is that we don't try to empower women so that they can be better off. We do it for the self-interest of the entire community, meaning thereby women are change agents. If the women are more empowered in almost all society in this world, women are the caregiver at the family level. So if the women are empowered, the family will be better off. So argument has moved away from moral reason to one that it is good for all. Therefore, we should. Now, there's a third approach. It's called what I call human development approach. Many of you may not even heard this concept. Human development is the strategy the United Nations and World Health Organization use to develop health and human attributes so that society will be better. And of those attributes, health is one of the key ones. Second one is education. Okay? So human development approach argue how can society as a whole be better off? What is it that we need to do? And human development approach have come back with the notion that in order to develop community, we need to do many things. For example, gender equality, okay? Fairness to other racial groups and other special groups. All have similar rights. So they took the position that until and unless world as a whole can agree upon the consensus upon what is right that everybody has the claim of, we will not be able to go. So they emphasize on developing consensus. Now, has anyone heard the Declaration of Human Rights, United Nations Declaration of Human Rights? You haven't? Okay, some of you have heard. It was in the 1948 when the United Nations was established. And let me, the number one, these are some of the international consensus about how to make community better. Okay, and the very first one was the Universal Declaration of Human Rights. In 1948, it was passed, adopted. As of this year, more than 195 countries signed this declaration. So the way international consensus work is that a group of people will come together and make a very meaningful presentation, the problem, and why we need to come to an agreement about some consensus. Then the consensus is the declaration, like our Bill of Rights, you know. And if you, many of you may be students of history, know that in the Western society, Bill of Rights or the individual right is not a new concept. It has happened many, many years ago, okay? And in fact, it started in Magna Carta, which was in England in 13th century. And of course, those of you who are interested in history and antiquity, it was there in Sumerian, Chinese, and Indian literature and cultures about 6, 7, 8,000 years ago. Now, I would not go that route, I'm not a historian, but let's start with the modern history. Modern history, we can trace back the Magna Carta, from which US Constitution, United Kingdom, Australia, and many other, France, they adopted their own constitutions. So that is the starting point from the modern history. The second declaration, which is very important for health, is the CEDAW, Convention on the Elimination of All Forms of Discrimination Against Women. Why women? Again, I won't get into too much of a detail. At least 51% of the world's population is women, right? So if nothing else, that's one good argument. But the second argument is that almost many societies, women has been unfairly, unequally discriminated, even in the well-advanced societies, industrial societies. So idea that women's needs, women's health, women's rights needs to be specially protected if society has to develop. And then after, the third one has to do with the children, okay? So these are the three examples. Those of you who are interested, these slides are available to them, right? You can go to the original source. I've given the links. You can look into that. What I'm going to do now is to, this is a list of many, many declarations. I would not spend time. You can look into that in the slides PowerPoint at your time, at your leisurely. But one of the points I want to make is the very last one, the Kolkata Declaration, which happened in 1999. And I had the good fortune to be able to attend that. In the Kolkata Declaration, when you say they're not only talking about gender equality, they're talking about poverty elimination and elimination of hunger as the basic human right. So what you see is that what I call the change, time has changed, that focus from disease, from women, it's now become much bigger. The issue is equality, freedom, and rights for all. Okay, that is the change in the society and the time that we are involved today. What I'd like to do show is that now move on to and show some of the change that has taken place in the health field, public health, medicine, healthcare field, and what does it mean for human rights. Okay, all of you are in medical school, right? Most of you, at least.
It's a mix.
Huh?
It's a mix.
Okay, mix. You all know that when did the modern health science begin? Anybody? Before the modern health sciences, which is basically based on the germ theory that came in the 17th, 18th century, okay? Before that, we still had theories about what causes diseases, right? Every society had one. So for example, If you come from Asia and India and Buddhist kind of a culture, it's all karma. What you did in your past life causes what the problem you have this life, right? Now, I don't want you to go back to your past life, let's stay this life. But then in the early Europe also, before the germ theory was discovered, people explained illness, they used to call miasma, bad air. So diseases were caused by bad air. You have to clean up the air. There was no concept of germs, okay? There was, in Chinese medicine, they will talk about qi is a life force, and it is maintain a balance, yin and yang, right? So the concept of explanation of what causes health illness goes back to thousands of years. But then I call this a paradigm shift. From that paradigm, I call faith-based paradigm, belief, right? Faith doesn't mean church. Faith means belief without proof, right? And these are the explanations of causal explanation used to be without scientific proof. People believe them, faith-based. Then paradigm shift, what we call age of reason. Those of you know history, you know what I'm talking about. Age of reason is supposed to be everything is explained by science, right? In scientific age of reason, came the notion of 1796, Edward Jenner, who actually discovered the vaccination for smallpox. And Jenner, then you have a Louis Pasteur and others, started the whole movement that diseases are caused by some germs, okay? If you can eliminate those germs, then disease will go away. That was the paradigm, okay? Am I going too fast? Okay. Then came age of declaration. This is one I want to take a minute and talk about it. A lot of people found that a lot of illnesses cannot be explained by germs alone, okay? Then what, and yet we need to have prevention because they're killing people, plague, smallpox, malaria. In fact, most of the diseases that we have controlled so far with the age of reason or science are not even there. So some of you will go through the entire training, not see a single smallpox case, right? They have disappeared from the world. So the world began to say that, okay, let the scientists find the causes, scientific causes of disease prevention. In the meantime, we've got a problem we need to solve. So they begin to come together and have the declaration about how to keep people healthy. And I gave the example of 3 declarations before, but I'll move on very quickly. Then we talked about the Universal Declaration of Human Rights. They felt that if you don't have certain basic rights, the society doesn't make progress and people cannot be healthy. Therefore, protection of human rights becomes part of health development and health care. Okay? In the field of health, more specifically, the first declaration that made a lot of sense for health is called Alma Ata Declaration. I don't know if you have come across anyone in the room. Alma Ata was in 1978. World Health Organization and UNICEF came together and they looked at the whole world and found that when they began to collect data at the World Health Organization, you find spectacular things, right? When you talk aggregate level, we don't see those differences. But for example, if you're born in sub-Saharan Africa, your life expectation is about 40, 44, okay? If you're born in Japan, it's about 85. Why is it the same age, same year, 2013? If you're, depends upon where you're born, some people live 40 years longer than others. It has nothing to do with science, right? It's not genetic. So they begin to look at that there are a lot of other factors beyond science that affect, and we need to deal with them. And Alma Ata came with the notion that we need to change the emphasis in healthcare from germ-based theories into more broader social reality. Okay? So instead of talking clinical medicine or clinical epidemiology, they came with the phrase called primary health care, PHC. You will see that in a lot of literature, in the WHO literature, United Nations, PHC, primary health care. I must tell you one thing, that primary health care definition of the WHO is very different than the primary health care the way we define in the US. Right? In the US, we don't define primary health care. In the US, primary health care is what? The first contact you make with the healthcare provider, kind of care you get, that's called primary health care. Whereas the primary health care in the third world countries, poor countries, focuses on sanitation, immunization, right? Things like that, because there we find you don't have a clean water. More than 10 million children die every year today, not because we don't have the science, We all have the technology. Very simple. Train the mothers to give some water with salt and sugar, right? Oral dehydration. It doesn't require heavy-duty science. And yet, of the 10 million children die per year, 91% of them because of gastroenteritis and waterborne diseases and illnesses and infectious disease. Okay? They can be all cured, prevented, not cured, prevented by intervention that has very little to do with medicine in the clinical sense. Okay? So the Almata Declaration said that we need to re-emphasize healthcare for the whole world and focus mostly on primary healthcare. And the two concepts they have thrown out in primary healthcare, which is extremely important today in our interest in health. And the first concept was that community participation is the very important concept. They came with the notion that you cannot really do primary health care, like you cannot clean up the water, okay, unless community as a whole agree upon to spray DDT on mosquitoes to kill malaria. So you have to have a community participate. They have to have. And second concept was that primary health care should emphasize on the immediate needs of the population, not heavy-duty, high-technology intervention to prolong life and keep people before they die sick for longer. You know, that's what it does, mostly terminal illnesses. So these are the two major changes, primary health care, that community participation and doing more basic prevention rather than tertiary care as the emphasis. Now, I went to school at you mentioned my introduction. I was a student in 1960 to 63 at Berkeley. You know what I mean. Those are the years all hell broke loose. When we were demonstrating and Joan Baez coming with a guitar and David and all that singing in front of the School of Public Health. We were highly active in everything else. And yet, nothing I read or heard in the lecture, the word empowerment was never used. You will not find the word empowerment in any literature, even in 60s. And we are revolution, we're empowering everybody, right? I remember the first time, 1964, UC Berkeley wanted to introduce women's studies. And I could see all my professors, they got very irritated. What is this women's studies supposed to mean? Science is science. What's women got to do with it? And if you say, well, women have a problem or we have a different paradigm, they say you're going to water down the science. We don't need women's. They can be studied under sociology, epidemiology, whatever it is. So that was the attitude, that was the paradigm. Now today, even in medical school, use the word empowerment, patient empowerment, right? So things has changed quite a bit. Almata was, so one of my boss back from India actually went to Almata. When the Almata, I was a very young professional, I was a little buddy, nobody cared for me. I didn't have a chance to go there. So when my boss came back, I asked him, I said, look, we back in India are talking about empowerment. Why isn't the word empowerment in Almata Declaration? This is the important question, isn't it? I mean, world body coming together, trying to make the world happier, healthier, better. They recognize the importance of community participation, but why not empowerment? Could any guess why do you think it was not used?
It's too subversive. Too subversive.
Exactly. At that time, 1978, okay, 70 countries of the United Nations were either ruled by military junta or ancestral dictators. They were scared of the word empowering community. That's an excuse, right? That's the disguise of starting a revolution. So they would not have nothing to do with the word empowerment. But today things have changed. This is the point I'm trying to emphasize later on. Okay. Then we moved on when Almata is going on. In one of the declarations, I went very quickly, 1988, called the Ottawa Charter, in Ottawa in Canada. The United Nations, the World Health Organization has 5 regions, Europe and PAHO, Pan American Health Organization, that the United Nations comes under. They got together, they began to talk about, look, our problems are different than the problems of Congo or Vietnam. We don't have all these children dying because of the bad water. Our problems are elderly people, they're getting older, drug use, drug abuse, many other problems. So most of the problems we have really are not based upon germ theory, but these are social and behavioral in nature. So we need to focus more on social behavioral dimension, bring that in medicine and public health so we can deal with that. And in that time, have you seen this study, CDC study 1993, Bill Fahey and Mike McGinnis study is a classical study. One of the things I will show you slide, it will come later, I don't want to change the sequence, then I'll get mixed up. But one of the things that happened in the last, say, 4 or 5 decades in the industrialized society, the 10 leading causes of deaths have changed, right? People will always die of something, but the reason or the causes for death in the 1950s or 1900 were very different, the causes of illness today. And I'll have a slide later on, I'll show you that. So the diseases that people die of today, 3 top ones, okay, cardiovascular disease, cancer and stroke, all 3 were related to tobacco smoking. Follow me? So McGinnis and Fahey analyzed the data, causes of death, rather than disease, but by behavior. When you analyze it by behavior, you find they came with the notion more than 50% of the illnesses which kill people in USA were caused by human behavior. Today, that percentage is even higher. This was 1993, almost 20 years, 15 years passed by, and now even that percentage is even higher. Okay, so the question is that the causes of change. So we need to look into health behavior. That raises the whole new field called health promotion. To keep it separate from primary health care, health promotion focuses on changing what we now call lifestyle change, changing people's behavior, as opposed to immunization, vaccination, sanitation, and so on. This came in, some of you probably don't remember because it was before you were born, I think. Everett Koop was the Surgeon General. Has anybody here heard about Everett Koop? Yes? What was his mission? Smoking. He pushed smoking and smoking. 1964, Surgeon General's report came in, and which said the smoking related with risk behavior and how human mind worked. Very funny. I was a very heavy smoker. Coming from India, those days, my generation, everybody smoked. If you didn't smoke, you were a sissy or a coward. But I'm telling you honestly, frankly. And you know, our pride was we never carried a lighter or a matchbox in our pocket because we light one cigarette with the other cigarette, chain smoking. So if you keep a lighter in your pocket, that means you're not strong enough. Came from that culture. And I was in School of Public Health, my professor in the climbing class smoking pipe. Right? This was the culture in the 60s. Then came 1964, Koop's report. I mean, not Koop, it was before Koop. Surgeon General's report said that, you know what I did? My health behavior? I stopped smoking cigarettes the same day. Instead, I went out and bought 3 pipes because the report said nothing about pipes. You follow me? So this is how human behavior, health behavior changed. And then I quit pipe, pardon? Yeah, because I said, well, it's nothing about pipe. I mean, nothing about pipe smoking, so that must be good. I mean, not good, but harmless. Okay, but then when I really stopped smoking, I mean, pipe, that's a whole different reason. It had nothing to do with health. I tell this story just to tell you how human mind works. I was in Michigan those days, and Michigan, as you know, very cold, and it snows outside, it's cold, you can go out. It's, you know, one of my most pleasant time was 9 to 12, okay? I used to sit in my living room, have a fire going on, have my best music I like on, and whatever I read, student paper grading and boring things, you know. So I had that fun thing, smoke pipe and drink a little single malt scotch. That was my favorite thing. And, you know, and then suddenly our son, Robin, who is now a full professor, he was about 8, 9 years old. My wife was a health educator. She was director of cancer prevention. You remember, same house, and I was smoking pipe. This doesn't happen today. But anyway, Robin came and he threw himself on my lap and started to sob, like hysterical. He said, what happened? What happened? After about 2, 3 minutes sobbing, he finally said, Daddy, you're going to die. So what do you mean I'm going to die? I'm feeling good, I'm healthy. He says, no, Mom took me. And what came out of the story that Barbara, she was the director of a American Cancer Society public education program. They used to have all these public education sessions, and they used to have a little glass jar with the lung of a man who died of a lung cancer. to terrorize people, to stupid. And he said, well, they said that people who smoke, that's what happens to them, and you're going to die. And I stopped by saying they never touched it. And the point I'm making is that people change behavior for many different reasons than just health reasons, right? And we're not rational beings, although we like to believe. So when I switched from cigarette smoking to pipe smoking, at that time nobody laughed at me. Today you all laughed at me, And another example, this is a little X-rated joke, but I'll tell you since you're all adult, how the society has changed in health. There was a time when you go to a drugstore, right, and say, very loudly, give me a pack of cigarettes and a dozen of condom, right? And today you will go and say, give me a dozen of condom, a pack of cigarettes. See how social norm changes? And these don't change just because I gave a lecture or they made a poster. These change because of social and normative structure. So health promotion, disease prevention, and Coop's second wave of health promotion was free condom distribution. He was mailing out condom to people's homes wherever there was a teenager. He was revolutionary himself, and he was an MD. Okay, so we now have come to age of human development. This is the point I want to emphasize. Remember I talked about human development approach under United Nations? United Nations has done some beautiful studies, and I'll come back and show you a little bit. Human development are saying is that health, education, and overall economic development, they go all together. You can't just maximize health development if you don't talk about other factors. So they're talking about, they came with the concept, health and human development. Each year now, United Nations, if you're interested, go back at UNDP, United Nations Development Program, UNDP. If you log in on their website, each year they rank all the countries on human development indicators. The human development indicators include literacy, okay, as an empowerment tool, infant mortality as a proxy measure of healthcare system of the country, okay, and health itself, life expectation. They combine those things. It started in 1990, and today human development indicator has expanded to 5 indicators. They added 2 more. The 2 more that added are number 1, 4th one is women's empowerment, okay, and the 5th one is poverty elimination. So if today's human development indicator, you find, for example, Canada, which has a lower income than we have per capita, their health indicator is much better than US. And many other countries, you'll find United Nations rank about 20th, 30th in developing countries, almost at the bottom. Children's performance in science and math in the United States is deplorable. United States is excellent when it comes to graduate education. Universities are first class. Only last week you have World University Ranking. US has 18 out of 20 top universities in the world. So when you come to high power research, graduate level, US is great. But if I'm a poor man, I would not want to live in the United States when it comes to my children's health. Okay? So anyway, then came United Nations called Millennium Development Goals. Each year the group come together and they set goals for them for 10 years down the line. And the Millennium Development Goals have 8 goals. I would not read them, take too much time. You can log on. But 2 of the goals, one is gender equality or gender empowerment, and second one is poverty. So what I'm saying is we have come a long way, starting from germ, okay, to health behavior, to, we are not talking about cultural, social, gender equality, and so on, as our legitimate concern for health and well-being of society. How am I doing time-wise? What is that? My 20 minutes passed a long time ago. Nobody warned me. Okay, being that the case, I'll quickly go by some slide to show you progress we made, right, because of the change in health. You can see this is crude death rate. And I will go very quickly because all these things you know, and if you don't know, you can look at it. Drastically gone down, okay? Smoking, 1965, about 42% people smoke. Today is about somewhere around 20%. It cut down to 1/2. 1/2 cutting down smoking is 20 years is a miracle. It may sound too long for you guys, because for your age, 20 years is too long. You're barely 20 yourself. So most of you. Okay. Another achievement, smallpox officially declared dead in 1980 by World Health Organization, although there are a few here and there poking their heads up. Okay, this is the chart I was talking earlier. If you look at the top chart, the 1900, most people died of pneumonia, tuberculosis, I can read this one, diarrhea, and diarrhea, heart diseases was fifth. Today you find heart disease, cancer, stroke, and chronic diseases. So significantly changed. Today, people are dying mostly, 60% of the deaths are non-communicable diseases. Communicable diseases, 31%, 9% are injuries. Okay? So you see how things have changed. Now, this was the research I mentioned earlier. Fahey and McGuinness came back with the notion that health behavior was a major reason of health and illness, right? And this was in 1999. Then I bumped into this declaration. It was year 1675 AD. In one of the Hindu scripts, it says, disease, grief, affliction, captivity, calamity are all the fruits of human behavior. So after this wise guy in 1675 said that human behavior is a problem, in 1999 we confirmed that with research. Okay? I'll pass this. Now, made all these changes, but underneath those changes, we also have created some problems. And I want to share those with you. I've got, 7 minutes left? One thing we've done, and I would not take too much time explaining because we don't have time, income disparity has grown larger. Okay? Well, people are getting, if you see on the very level, 1979, okay, lowest quantile, lowest 20% people, if you rank them in population, in 1979, if you see, see this? Their income went down, the lowest quintile. And if you see the highest quintile, went up, right? And see the difference between these guys and these guys, about 7, 8 times. So one of the things that we've created in this process is that enormous change in income. Life expectation, if you're richer, in the richer countries, life expectation. What I'm going to do, since I have so little time, I will quickly flip them. You can quickly see here that what happened, the income infant mortality. Wealthier you are, a lot less infant mortality, right? In other words, there's an enormous disparity. This is global burden of disease. I don't know if you're familiar with the concept yet. And you find that there, the yellows are actually in the high income category. In high income, blood pressure, smoking, cholesterol, those are the problems. And you see the disease patterns also vary by income, okay? And you find that future in health, today the heart disease is #1 causes of death. 30 years from now, not 30 actually, 18 years from now, cancer is going to be higher. So patterns of disease is also changing, okay? Life expectation, if you are in a rich country, you expect to live about, if you see the difference between these two, about 20 years difference. Okay, idea is that while all these changes happening, disease get wiped out and so on and so forth, we're also creating disparities, okay? That is the main point here. So let's move on. Immigration, only statistics I want to give you today that when the United States was born 235 years ago, there were only, census were taken 1780 or 1870, I forgot which year. They're all whites because the native Indians, they didn't count them as US citizens, okay? And African Americans were not counted. There were very few Asians or Hispanic and so on, okay? Today, if you find that Hispanics are the second largest minority, will be pretty soon be overtake the blacks. And point is that today, if you take they're saying that about 52% of the Americans will become non-white by 2050. Okay, so in other words, United States is not going to be a dominant majority of whites and minority, but United States will be part of one large multicultural group. If that happens, for a moment stop and think, what changes does it do to health status, health behavior, health belief? And I would not go into, because we don't have time, I'll do 3 concepts I will send out. One, do you know the French paradox? Have you heard of it? Have you heard the Hispanic or Latino paradox? You've heard of the Asian paradox? French paradox, this is interesting, so I'll take half a minute. The epidemiologists found in many conferences research data, the Frenchmen eat more, exercise less, smoke more, they are more overweight than the American, and yet about Americans are dying about a third more in cardiovascular risks. So why is it that Americans are doing all the good things compared to the French people, and yet Americans are? So what they found, French people do all the bad things, but they also drink a little glass of red wine. And the wine cleans up your arteries and keeps you healthier. That came with the notion that normally you think that, not exercise, so it doesn't correlate scientific data, that they're living longer in spite of all this risky behavior. That the example I used to show that sometimes we learn good things from other cultures. Okay, this is one example. Hispanic paradox, very quickly again, we find that Hispanic have a lowest health insurance, lowest rate of physician visits and using medication health care, and yet their health care in terms, especially their child reproductive health, their pregnancy outcome is significantly better than the whites and any other Asian. Asian paradox is the example when about 40 years ago, Vietnamese, Cambodian, Laotian refugees came back from those Far East, and they settled down in the slum areas like Los Angeles and New York, where crime, drugs are rampant, and schools are very bad. And yet Asian children are performing better in math and science than the whites in any other group. Why? These are all 3 paradoxes tell us that each culture has something, what we social scientists call cultural capital. Cultural capital implies is culture have some behavior, values, and practices, traditional, that give them some protection. And in a multicultural society, one of the good things we do is that we can learn from those things, those behavior, and society as a whole come better off. Okay? Now, my last most favorite, in 2 minutes I want to close up, is to show 2 slides to make the point that you are future leader of the healthcare industry, profession, science, as however you define it. You have to look forward which way society is going, and which way science and the field is going, and how we can make a significant contribution. This chart shows, it's done by Amartya Sen, my favorite mentor in terms of my intellectual mentor. He was awarded the 1998 Nobel Prize. He did 2 pioneering research, and those 2 research I want to share with you. Let me ask you something today. When this was a long time before you were born, but imagine yourself in London during the Second World War and the First World War. In the Second World War, your parent generation, not your generation, of course, the bombs are falling, this infrastructure destroyed, everything is destroyed. Would you expect at that time, during the war, in a big city like London, and England is an industrial city, life expectation to stay the same, or to go down, or should go up? What do you think? In the middle of World War II and World War I, life expectation should go down, right? Okay. These 2 red bars are the life expectation during the First World War and Second World War. Okay. Why did it take Second World or First World War? Because those days you did not have a good data in other countries. England has a very good data system. England and Wales, why is the life expectation going up when people are getting killed with bombs from Japanese and Germany, mostly German? Any thoughts?
Eating less.
Huh?
Eating less.
That's our mental framework, because we are all obese. Right? But you're on the right track in the wrong direction. Meaning thereby, because of the time is little, I'll give you the answer. Sen's theory was that England is a democratically elected government. In a functioning democracy, when a crisis happens like this, what does the government do? Give a step further. Ration. Who said ration? Yes. When you do ration, the government comes in, because government responsibility is to minimize casualty, right? So government ration. When it rations, what does it do? You guys know, you are so born in a wealthy country, you don't know what ration means. You know what happened in ration? Ration, government comes, takes everything, food and sugar and oil, whatever essential commodity. Then they will sell them to the people at a price. Government is not there to make business, right? They are not make profit. So they are selling at a lower cost, right? And then you are really poor, can't feed your family. Then in addition to ration, what does the government do? Relief services, right? Free food and free care. So net result is that during the war, poor people in England are eating better and getting better medical care, while the rest of the country is dying. So this is a profound importance. From that he developed the system that this can only happen in a democratic country. It will not happen in Congo or any other country where dictators. It only happens in democracy. And his whole thesis is that in modern democracy, not a single country had a famine. And yet, China had a famine in 1965, about 30 million people died. So from that he comes with the notion that one of the strongest things we can talk about development is the freedom of choice. And his book, one of the main reasons why he got the Nobel Prize, called Development as Freedom. And I strongly recommend you read the book when you have time. Development as Freedom. It is a game changer. It has changed United Nations systems. All the human development system is based upon his research and so on. Now come back to this is where I'll end today, this slide that I started. This is, if you take any developed society, okay, United States, Germany, Japan, or other, there in a population you have roughly equal number of boys and girls are normally born, right? And therefore you assume that when they grow older, okay, and women also live longer than men do normally, right? So if you take any society, if you take the gender ratio of the older people, 50 plus, if you find there are more women than men, this can become an indicator that you have a better gender equality in that society. You follow me? Now what happens is that in these countries, the reds are all where fewer women than men, okay? And on the green charts are the countries where you have, for example, Europe as a whole, okay? There are more women than men. That's what you expect. But I show this slide to show, number one, if you do not have the equal access to healthcare, food, and everything, boys and girls, right? Then you find that in a society, there will be fewer women than men. A society which is more egalitarian, you will find more women than men, right? So gender ratio can be used almost as an indicator of gender equality. But one of the most important things in this chart, you guys probably don't see it because you find there is a state called Kerala. Oops. Kerala, okay? You see where India is, right? Now India as a whole has a fewer women than men. But the state of Kerala is a part of India where there are more women than men. Why?
It's communist.
Used to be, and still is. But what does Communist Party vote doesn't give you medicinal drugs, right? But what does communists do to you? By the way, I come also from a state, Bengal. Used to be communist up until this new lady came in. Yeah. This is also another story, but I won't go into detail. World's largest democracy has two communist states. Isn't that a paradox? But anyway, come back to the main story. Main reason is that, in view of time, Kerala historically has been very, very progressive. And I'll show one chart where you compare Kerala with India. You look at the indicator. Death rate in Kerala is 1/3 less than the all India. Top, okay? If you find rural birth rate, Kerala is 18, India as a whole is 28, right? In infant mortality, 16, and all India is 72. All the good measure Kerala is lower, including per capita income is also low, okay? And doctor-patient ratio is also lower. Why is it that in a state where you have fewer doctors, less income, and yet health statistics indicator is better? And this is why I conclude my presentation because of the time limit on it. What Kerala has, as you pointed out, even before it became communist, India became independent in 1947. the social change don't happen in 30, 40 years. India has historically very progressive. They had the rulers either their one of the moral dharma was give more charity to their people. They had more hospitals, okay, more education, more literacy. What is more important is that if you look at the female literacy rate, okay, 86% is Kerala, okay, and men's literacy. So you find education, more participation of women in social and economic activities, and society as a whole is more responsive to people's need. These variables, these factors makes a greater impact on the healthcare than simply having a democracy or communism. Okay? So my mission, my statement is that global health, we are increasingly going to be working with countries, some of them poor, some of them rich, right? Some of them are transition. And we need to understand better what social, cultural, and traditional factors that affect health, well-being, and not just limit to biological and sociobiological model for health. Thank you. I think we have a few minutes.